The following segment is sponsored by Northern Nevada Health System.
It is Heart Health Awareness Month, and we're here at Northern Nevada Health System with Dr. Letitia Anderson, who's a cardiologist here, talking about women in heart health. Well, good to see you.
Great
Appreciate
to meet
your
you.
time.
Thank you.
A heart attack, is it different for women than for men?
Slightly, yes and no. And here's the down low on that.
Okay.
50% of people will have atypical symptoms when they are experiencing heart attack symptoms. So what we'll say as cardiologists is anything from nose to navel, between your nose and navel, something wrong, something persistent, something that really is interfering with your day. Women statistically have slightly more of those symptoms, but it's important for people of all genders to understand that symptoms might not be crushing chest pain when they're experiencing a heart attack.
Okay, and so women, when they experience being with a child, childbirth, being pregnant, and then also with menopause.
Yeah.
How does that play into this whole equation?
Good question. Pregnancy is a load on the heart, so you can have more problems such as hypertension, edema or swelling, maybe breathlessness, and it's important to be aware of those signs. Menopause, the loss of estrogen and progesterone, women's risk of heart disease goes up very fast, and we lose that protective effect of hormones. So immediately after menopause, unfortunately, women's risk of heart disease goes up dramatically.
And speaking of risk, if you're a woman of color, the risk factor goes up. Why is that? Do we know?
Right. Yeah. And a lot of it, unfortunately, is what we call now the socioeconomic determinants of health. So people with lack of access to healthcare, be it food insecurity, be it lack of geographic closeness to your hospital systems, or even maybe lack of health insurance, are all risks. And unfortunately, people of color and people of different ethnicity, including women and children, are at much higher risk, often based on that, let alone their genetic predispositions.
Interesting. But you're focused more on what's going out there in society versus the genetics of it.
Both are important. Unfortunately, more and more, we're realizing that these unfortunate circumstances are what causes these problems.
Okay, for all women, how can they reduce the risk of heart disease?
Great. Simple. Heart disease of all types, for women included, is probably across the board 80% preventable. We know that. And really, it's access to healthcare and access to talking to providers and even your community. So learning what your risks are: cholesterol, diabetes, obesity, sedentary lifestyle, blood pressure, and as you mentioned, aging and genetics. Most of those we can change and have an impact on.
Okay, very good. I'm glad you're talking about women's heart health, because a lot of people think it's big dudes that suffer from this stuff, and it's not so.
Not so much.
Yeah.
Not so much. Every population, including women, is extremely valuable and vulnerable.
Okay, Dr. Letitia Anderson, good to see you. Appreciate your time.
Thanks for having me.
And for more information, go to our website.